Before we begin, I'd like to acknowledge the Gadigal people of the Eora Nation, who are the traditional custodians of this land, and I'd like to pay my respects to elders both past and present, and extend that respect to other Aboriginal and Torres Strait Islanders who are with us today. It's my great pleasure to invite Professor Robert West, Editor-in-Chief of Addiction Journal, to say a few words about the book. And if you'd like to come up, Robert, thank you.
Yeah. So, well, this is terrific, and it's the culmination of, well, for Shane and the team, many years of hard labour, but very productive labour. For myself, my role in this process has actually been something along the lines of a sort of midwife, I would say, in that when Shane indicated to me that he was writing this book and was looking for a publisher, to be quite honest, I think the reality is that pretty well any of the academic publishers that Shane went to would have jumped at the chance of this book, because it's a fantastic book, it's a terrific idea, it's going to be a blockbuster, I'm sure of that. So they would have jumped at it. But I think that the publishing model for academic publishing of books needs to change, and I had been working with a publisher, Silverback Publishing, who are not unrelated to me in DNA terms. In other words, they're my children, right? Okay. And then trying to persuade them about a publishing model for academic work that I thought would be better in terms of being fair to the authors and getting good work published and disseminated appropriately. And I had persuaded them to publish a number of other books which have sold very well and it seemed to work very well. Anyway, so the publishing model I thought was better, it's more agile, I thought it could deliver what Shane wanted. And so I was really pleased, and slightly apprehensive, I have to say, when Shane agreed that Silverback would be a potential publisher for this book. And that wasn't so long ago, because the whole process then went pretty quickly, and it's been about as smooth, I think, as you can expect as publishing enterprises go. And I have to say, the content of this book is really something else. I just dipping into it, I find I go to a page and I think, oh, that's cool, that's really interesting information. And that's, I think, partly how people are going to use this book. People are going to just look at it, they're going to go into it, and they're going to find interesting stuff in it. But for clinicians working in any area of medicine pretty well, who are going to be confronted with and deal with and have to help people who've got problems with substance abuse and illicit substance abuse, this book is going to be a goldmine. It should be on their shelves. It should be on the shelves of every clinician, whether they're in general practice, primary care or secondary care. It's not even an expensive book, because it can save lives. When you've got someone with a particular problem, a particular set of needs, and you've got information which you didn't have, which can help you to manage that case, whether it's in relation to their addiction or in relation to the medical complications of that addiction, you've got something that can make a difference to people's lives, and that's what this book is. So it's been a huge privilege, and I'm really delighted to have been able to play a small part in helping this book to get to a publisher that I think will meet the author's needs. And so it's going to be terrific. It's going to do terrifically well in Australia, I think in the United States, certainly in the United Kingdom, and I just want to congratulate the authors on a terrific job. Thank you.
Thank you so much, Robert. Our next speaker tonight is one of the authors of the book, our very own Professor Michael Farrell, who is Director of the National Drug and Alcohol Research Centre, and he's going to speak a bit from a clinician's perspective, I believe, tonight.
Robert, thank you very much. Very kind words, and very nice of you to come all the way from London for the book launch. And we have people from New Zealand, we have people from all over the world. It's obviously generating great interest. But look, I'd like to thank everybody for coming here. I'd like to thank my colleagues from the Faculty of Medicine here. It's a mark of respect to have a full range of people here. But I'd particularly like to thank Shane for leading with this thing, and just to say that the point of this book came from a lot of discussion we had about a gap, which was that there's lots of books which tell theories of how things are and all that, but they actually don't provide a balanced notion of what the nature of the problems, particularly physical and mental health problems, generated by the plethora of substances that are out there now. And I think we've successfully pulled that together. It started with us talking about a book on the physical complications of injecting drug use, but it actually, we felt it really couldn't work without actually beginning to describe the different substances and how you might handle them. And we went around it quite a lot of different ways and finally came up with the format. And I'd particularly like to also mention Julia Lappin, who is away in Europe at the moment, but her input on the mental health side of things and some of the other physical aspects was invaluable. And at that, I'd just like to thank everybody and get on with it.
Thank you, Michael. For those of you who have spent any time at NDARC, you will know that Shane runs the NDARC seminar series. And Shane has a cycle of visitation that he does on a Thursday afternoon where he pops into people's offices. And I was one of the people who used to come and visit on a Thursday afternoon. And I remember talking to Shane about the very early embryonic idea for this book a few years ago. And I said to Shane at the time that it does take a person at a particular point in their career to be able to write a book like this that reflects so broadly and across such a huge body of work and various ways of thinking about illicit drug use. So I'd like to invite Professor Shane Darke, lead author of the book, to speak now.
Well, thank you firstly for your attendance tonight. It's very much appreciated, and I suppose I should start by thanking Silverback for the opportunity to publish and for seeing the value in the work. Because when you come up with a book and say it's about a whole bunch of diseased organs, it's not necessarily that easy to sell, but they saw it. And also I think the great thing about Silverback, the previous publishing companies, some academic publishing companies, love best kept secrets. We've published books where the aim of the company seems to be they've got a wee office on the top of Mount Kilimanjaro where you go up there to find a copy of the book and they say, "I'm sorry, we're out today, sir." And it's not like that. We actually want this to get out to people. Look, a book like this, my co-authors, Julia and Michael, it wouldn't have happened without these people. Julia is a practicing clinician, a psychiatrist who work on neurology, pregnancy, and in this book, psychiatry was exceptional. And our man Michael's is encyclopedic knowledge of all medical issues in the drug and alcohol field, and indeed his encyclopedic knowledge of James Joyce, which I think we spent probably even more time discussing, is invaluable. The day-to-day meetings we had on this informally made the book what it is, and it's very much appreciated, Michael. Why write such a book? Why write a medical book? You know, why would a broken down old psychologist do this and devote a year or more of time to doing this? Well, I realised that I'd been doing behavioural medicine for the last 30 years. Felt a little like Moliere's gentleman who was shocked to find he'd been speaking in prose all his life. You think, really? Is that what I've been doing? And when you unless you try hard not to, you learn a lot over 3 decades. And I didn't try hard not to. I've always found the whole area fascinating. And I've done innumerable studies on mortality and morbidity, read far more autopsy reports than any health is possibly healthy. And I've worked with inspirational colleagues and medical colleagues. And there comes a time in your life, I think, as Kari was alluding to, where it's actually time to draw back and collate. You don't not to always just reporting data. That's important. But to actually pull together 30 years of experience and look at a field and present something new it's very satisfying. And more, it's not a book we could have written when we're in our 20s. In fact, I think it's a book you've got to write when you can't even remember when you're in your 20s. And the few things you do remember probably didn't happen. So translational research has always been at the core of NDARC's mission. We were funded in the 80s to basically improve our knowledge of the harms and improve our knowledge of what works for treatments. So it's core to what we do. So in this work, we wanted to make a major contribution to the clinical field. We looked around, and like many things in the drug and alcohol field, it's astonishing what isn't there. Partly, I think this reflects that the field is actually, as a serious academic endeavour, is not that old. But there was no book. I thought, well, if a clinician wants a book to pull off a shelf on illicit drugs and, for instance, psychostimulants in the kidneys, where do you go? And we thought this was a major omission. It's also an opportunity. Our area is replete with myth, and it's a good opportunity to, at this stage, to just settle some old scores and say, that's wrong, for the 800th time. You know it'll become a thing, but you can say things in a book you cannot say in a paper, I'm pleased to say. So we designed it with the clinician in mind, as Michael was saying, but also for researchers, nurses. And we thought, well, what would a clinician or someone like this want? And it's a dipping book, as was alluded to before. It's not a page turner, although maybe, you know, you get into this sort of like, once you see those psychostimulants in the kidneys, you say, well, what's happening with those livers? This is where my life is at, ladies and gentlemen. That's what I call excitement on a Saturday night. So we went down the line of going through each drug class and going through the mortality, morbidity, each organ system. And we looked at things like novel psychoactives because we realised the field's changing, new drugs are coming on board, and when you look at novel psychoactives, it's chaos. So part of what we're trying to do is can we reduce the chaos? And for a clinician, what are the treatment options? What works for the treatment of methamphetamine? What works for the treatment of opioids? Now, I should point out that apart from drawing on our collective knowledge, we learned a lot of things. I think when you collate this much stuff, you learn things. And I feel that at a personal level, I think I've got a deeper understanding of the relative harms of all the different drugs from this process. So apart from the product, I've found it very rewarding. And in fact, so rewarding that I now, ladies and gentlemen, do some illegal cut-price surgery in the NDARC car park after dark, because I know about all organs. Now, it may not be the best surgery, and in fact it's probably undoubtedly the worst surgery. But by God, it's cheap. 50 nicker, any organ, no questions asked. Put your name down after here, I'll be signing books and I can put you down for some surgery. Look, it's our hope that in writing this book, the clinicians and others will find that it'll work of use in their daily practice, whether you're a researcher, a doctor, a nurse, or just a member of the public interested or a policy person. If that's the case, then our time was very well spent. So thank you very much.
Thank you, Shane. And now to officially launch the book, I'd like to invite Dr. Tony Gill, who's President of APSAD and a clinician at St Vincent's Hospital. Tony.
Thank you very much. I must say it's a great privilege to be asked to be here tonight to be involved in the official launch of this book. I didn't realise I was officially launching it. I'm just expecting a bottle of champagne to whack into the books later on. Yes. I mean, I was particularly excited about coming tonight because I heard that there was a book signing at the end, and I think it was in the 1992 I first saw Shane Darke speak about the opiate treatment index, and ever since then I've just wanted his autograph so bad. And finally I've got an opportunity to get it, so this is a great night for me. Look, I've been asked to speak as a clinician. I'm a mere humble clinician who works in the drug and alcohol field, and I think one of the key audiences for this book. And so I did take the opportunity to read it. We clinicians don't often read much, but I took the opportunity to read this book. I must say, though, that when asked to speak about it, no one checked what I was going to say, so that's a very dangerous thing. But commenting from a clinician's perspective, I mean, I've been fortunate. I mean, I work in a drug and alcohol service, both in the city and in the country, and work with people with illicit drug problems, and work with lots of other clinicians, and work with families and people who are affected by illicit drugs. And I mean, I've been in the field for a long time. I started when I was 2, so... but I've been in the field for a long time, and I guess in that time, you know, we've certainly seen changes in the drugs that are used. We've seen an increase in the services that are available. We've seen more clinicians working in the field. We've seen an increase in the professionalism in the field, and we've seen this explosion of information and literature and evidence, which has created of itself this, you know, increased need for these sorts of books. And the other thing that we've seen, or I've seen over the time, is that there's just lots of different sources of information, and unfortunately not all of it's accurate. And so there's another reason why we really do, we have been yearning for a book like this. Certainly, therefore, in my world of, you know, clients, patients, families, clinicians, you know, we experience sort of every day the challenges of trying to sift through all the information and to pull out what's really decent evidence to be able to treat people properly, and to be able to help people properly, and to be able to inform people properly so they can make choices about what they do. And it's not our strength, and it's not most people's strengths to do that. So this book, the concept of this book, you know, is certainly potentially very welcome in terms of helping, you know, the increased number of service providers that are around, clinicians, and also helping us to understand the changing drugs, but also helping to provide the right information both to us and to people who are affected by drugs. So there's a great deal of anticipation that I read this book. I've got a bit of an urge to say I think it was rubbish, but in fact... But in fact, I have to say it was fabulous, and it's just what we need. It's a book that's, you know, it hits the mark. It's incredibly well written. It's easily readable. It's concise, but, you know, it provides a really thorough coverage of the information that we need, you know, around the health issues and treatment issues, and it's comprehensive. I mean, I think it's I saw 663 references, which is just an indication of the book, and it's useful. I mean, in the time since I've read it, or in the time when I was reading it and since I've read it, for example, there was just a person at St Vincent's the other day with acute kidney injury who's using synthetic cannabinoids, and no one knew much about that, but that's written about in this book. And we've got people coming to us asking about, well, you know, what's the effect on the brain of the methamphetamines? It's written about in the book, or what's the effect on other organs? So this is incredibly useful to us as clinicians. It's useful to people teaching others, and it's useful to those who are using drugs and those who are, you know, the significant others of people who are using drugs. So this is a book which is really useful, but it is eminently readable, and it's actually written in a way which is very accessible, which I think is really important. I think it'll appeal to really broad audiences, and I've got no doubt that it'll be useful. And I also like the way it was set out. You were talking about that before, but it's also, you can refer to particular issues that you want to get information on, or you can just read it, you know. So the way it's set out, I think, is really helpful as well. So I think it's going to make life easier for all of us. So I'd like to congratulate the authors. I think it's a terrific piece of work and one that's going to really have an important place in the field. And thank them really for the work that they've done. It's an enormous amount of work goes into producing this sort of book. And for us who are working in the field and in touch with people who are having issues to do with drugs all the time, it's going to be, something that is really helpful. And I think, it's another example. I mean, I've been a clinician for a very long time, and I can certainly say without hesitation that, the contribution NDARC's made to evidence and to what we do as clinicians has been extraordinary over a long period of time, and this is another example in my mind of that, and I think that ought to be recognised as well. And also, being a bit parochial, it's written in Australia. I think that's pretty cool as well. So look, this is a book which I highly recommend, and I'd just really like again to thank the authors for all the work they've done in producing this book. It will be incredibly useful.
Thank you so much, Tony. I would like to echo Tony's thanks and congratulations to the authors, to Shane, to Michael, and also to Julia Lappin, who's not here with us tonight. I would encourage you to buy a copy, have it signed by the authors in real life tonight, buy it for a clinician in your life, buy it for someone you might be seeing over Easter. What a wonderful Easter gift. So I think we can declare the book officially launched at this point. Please continue to eat, drink and be merry, and proceed over to the book signing. Thanks, everyone.